My goal is to help as many people as I can that have the chronic issues and to really help them to understand there is a solution. Hi, I'm Dr. Barbara Rush, a licensed naturopathic doctor here in Southern California. I grew up in the Midwest and I was out in the country, and one thing I learned was nature was something that you could trust. I thought I would really like to learn the ways of nature to help other people, learn how to heal. When I was a little girl, my dad had a lot of cardiovascular issues, and unfortunately, I realized that when I went to naturopathic medical school and I saw the foods that we were taught are not good to eat were the exact foods that he was told he should eat the most of. And he did end up dying of a heart attack. That kind of really made me want to make some changes. A lot of times people will bring their labs to me that they've just had done and they're like, I don't understand. My cholesterol is exactly where my doctor wants it to be, but yet they want me to take an additional cholesterol medication. And I simply say to them, did you ask your doctor why? So helping people to understand what the real information is and what really should be out there, I think is really critical. I think what really drew me was the fact that HMG, and they get right down to it and say, look, if this is where you want to go, this is the best way to get there. A visit with Dr. Rush starts, first of all, with sitting down and talking with them about where they want to go, what they're willing to do. Some people don't want to spend a lot of money, or they don't want to do certain things, or they don't like this or that. Understanding that is important, because when you work in the world of nature, nature offers you lots of variety. So if they're not willing to do 1, 2, and 3, but they're willing to do X, Y, and Z, then I can go and use X, Y, and Z. For 20 years, I've been working with patients, helping them with a lot of hormone balancing. I use bioidentical hormones. I think that's critical. That involves every kind of hormone you can imagine, and helping them with longevity issues, understanding what it takes to truly have a healthy weight, but also helping them with basic things like cardiovascular health, and understanding that diabetes doesn't have to be this horrible monster. It can be something that is slowly but surely managed in such a way that those patients can actually have a lot more control. I want to be able to do to other people what I would want to have people do to me. I tend to be more of a minimalist, and I like authentic things, period. I work here Monday through Thursday, and I help people achieve a way of living that is going to involve them being able to enjoy life more. A lot of times when I was working with cardiovascular people, a lot of men would say, I'm afraid I'm not going to be able to walk my daughter down the aisle. Things like that are concerning to me, and I want to get people to a place where they can not have to worry about that. I help people with immediate things, and I help people with chronic things that they've dealt with for years.